Hey everyone, welcome to another episode of Diabetes Care-olina.
What is this episode about, Care-olina?
Treating alone.
Yes, so low blood sugar is something that often happens with type 1 diabetics because when you introduce insulin from outside the body, it doesn't work quite as well and as perfectly as when the pancreas produces insulin. So sometimes the insulin, does a little bit too much to bring the blood sugar down and it actually goes low. So low is considered below 70. What do we do, Care-olina, if blood sugar goes below 70?
So if it's an urgent or major low, ask your child to drink juice. But if it's a minor and not as important low, ask your child to eat candy.
Yeah, so sometimes what we do is if it's really on the borderline, if it's 67 or 68, we might do what we have right here in our diabetes bag, which is Starburst. 1 2-pack of Starburst has how many carbs?
8 carbs.
8 carbs. And the juice box has 14 grams of carbs. Close enough to 15. So what we have with type 1 diabetics is what we call the rule of 15. So what you want to do if you have low blood sugar is, go on, Care-olina, you're fine, is you want to have 15 carbs and then wait 15 minutes and then see where you are. So Care-olina has...
Or 14.
Care-olina has a continuous glucose monitor. Can you show them your continuous glucose monitor, Care-olina?
It's actually better known as a Dexcom.
Can you show them where it is?
It's right here.
She wears it on her arm, and what it does is it communicates via Bluetooth with Care-olina's iPhone. It reads the blood glucose, or technically from the interstitial fluid, and then it sends this information to the iPhone via Bluetooth. So here's what's going to happen when her blood glucose goes low. It's going to make that sound. Let's hear it again. Not that one. This one. That's what it sounds like. It's really loud. And if you hear that sound, you're going to look at the Dexcom and you're going to see what the blood sugar is, and it's going to be something below 70 because that's what's causing it to make that sound. I'm not going to show you right now because it's not below 70. So, Care-olina, if we hear that sound, what do?
Drink juice.
And where do you usually keep your juice?
In the pantry or in my backpack.
Yeah, if she's out of the house, she's going to go get a juice box from her backpack. So if you're with Care-olina and you hear that sound, you should remind her to go get a juice box from her backpack. She's not going to drink it right now because she's not having low blood sugar right now, so she doesn't really need juice. But what would you usually do, Care-olina, if you actually were low?
I would drink the juice.
Okay. So
or eat some candy. Any color wrapper of Starburst is always enough carbs for a minor low.
And if you don't happen to have juice or candy, juice or Starburst, that's fine. Some people use Skittles. Some people use orange juice. The important thing is that it's fast-acting sugar, so some kind of juice or candy. Some people use glucose tabs. But anyway, the rule of 15 is you're going to have 15 grams of carbs. This is 14, but it's close enough. And then you're going to wait 15 minutes, and you're going to see where the blood glucose is.
We call it the rule of 14.
Yeah, we can do 14 grams of carbs and wait 14 minutes. So then you're going to check the blood sugar again after your 14 or 15 minutes. And if it's above 70, then you're good to go. If it's still below 70, then you're going to drink and have Care-olina drink another juice and wait another 15 minutes and see where you are.
Or 14.
And usually by that time, everything is resolved and it's above 70. And if it's not, then probably a good idea to call parent of the type 1 diabetic to get some guidance and try to figure out what's going on. Maybe you need to do a finger stick. Maybe the Dexcom is wrong, but it's just a good idea to consult with the parent or other expert to try to figure out what to do next if you have a stubborn low that just won't come up. And that is the end of this episode of
Diabetes Care-olina.
Bye.